Well, you've been a great leader and inspired a lot of people, me included. Maybe let's talk about what's changed and what is changing. So in Vanderbilt, what's changed in supply chain over the last 3 years, and what do you see happening in the next 3 years for the supply chain specific to Vanderbilt?
I think what has changed is the level of engagement. So I talked about our physician engagement, but I never felt like it really was at the pinnacle of where it could be as far as our executive leadership engagement and the engagement of the chairs as well too as physician leaders. And we have finally over this past year been able to hit that pinnacle. We've revamped what we called our executive MEOC committee, Medical Economics Outcome Committee, which is our version of value analysis. And we now have the deputy CEO of our health system, our chief medical officer of our health system, our chief financial officer of our health system, our president of our regional sites, and our largest hospital president sitting on this committee, along with my executive medical director and myself, chief supply chain officer. Soon to be Yolanda Redmond will be taking that position as I move into the full-time president roles, and really starting to get involved in the overall cost per case, impact of decision making that's going on in the organization, looking at KPIs that we've been monitoring for years around contract compliance and what's driving non-compliance, focusing on physician interaction and engagement at the executive level and the CMO level to really say, we need to do this differently. We need to change the paradigm. We need to spend our money where it's appropriate to spend the money. And we don't need to lay off 600 more people like we did last June.